Name a few. Joining us right now is Dr. Abe Malkin. He's a board-certified doctor in family medicine and addiction medicine. And first of all, Dr. Malkin, thank you for joining us today. We do appreciate it. You know, you do urgent care house calls as well. How has this all changed your job as you know it?
Sure. Thank you for having me. This has been unprecedented times. Used to house calls for people and, walking into their home, shaking their hand, developing a rapport with them. Now, I've had to go into homes with protective equipment on, and putting myself at risk and potentially them at risk. So it's been a challenge for both sides really to adapt, but ultimately trying to offer this service, the house call service, to help prevent people from having to go to the hospitals, which are already overburdened, over capacity, and try to lighten the load on the medical system.
And do you see us wearing face masks a year from now, or from now as we wait for the first vaccines, really?
Yeah, you raised a good question. I think ultimately, until we have a vaccine, we're going to have to conform to some level of social distancing and effective equipment to dampen the spread of this, to flatten the curve, so to speak. And the vaccine could be at least a year away. So I do see face masks, especially in the healthcare setting, gloves, and some level of protective equipment being the norm, and even beyond the medical setting, certainly in group settings, people taking extra precaution to limit the spread as much as possible.
Dr. Malkin, here we are on we're on the cusp of allergy season. A lot of people wondering if they've got COVID-19. How are medical professionals like yourself handling just the symptoms of coughing, dry throat, those kinds of symptoms?
Sure. So, now with more coming available to rapidly expand use of testing to properly diagnose patients. So patients that are experiencing active symptoms, we're doing nasal swabs on them, sending them into the lab to get accurate results within 2 to 3 days. Those who are curious if they've had the virus in the past but aren't currently experiencing symptoms, we're doing antibody testing, which can either be done rapid point of care or through a lab draw that's sent to the lab for processing. And then, just general precautions for people. I'm really stressing the importance of, personal hygiene, maintaining social distancing, maintaining a strong immune system, by sleeping enough, making sure your diet is healthy, exercise as possible. Those are the things you should be doing around the year, and especially during this time.
All right. Thank you so much, Dr. Abe Malkin, for joining us today. We appreciate it. And I have to say, we had a little bit of a technical glitch there. You could barely hear some of what he was saying, but if you did catch a lot of that, it was interesting. And of course, you can learn more about him on his website.